Imagine a world brought to its knees by an invisible adversary. Can you comprehend the sheer scale of the global impact of the coronavirus? This unseen foe has traversed continents, crossed oceans, and crept into every corner of our lives. In a remarkably short span of time, it has spread with an unprecedented speed that has challenged our collective resilience. From the bustling cities of the Americas to the quiet villages of Southeast Asia, from the snowy peaks of Europe to the sun-soaked coasts of Africa, no place has been immune to its reach. Global efforts to combat this pandemic have been as diverse as the countries themselves, a testament to humanity's indomitable spirit. But the pandemic's scale doesn't only span geographically, it also varies dramatically in its impact. While some nations have borne a heavier toll, others have weathered the storm with fewer losses. The disparities are stark, revealing a tale of inequality that transcends borders and touches every facet of society. The reach of this virus is vast, but it is not uniform. So, how did the impact differ among countries of varying revenue levels? To understand the true scope of the pandemic, we need to delve into the disparities in mortality rates among low, medium, and high revenue countries. Let's start with low revenue countries. These nations, often grappling with limited healthcare infrastructure and resources, have borne a significant brunt of the pandemic. Their mortality rates, while not entirely accurate due to underreporting and limited testing, are thought to be alarmingly high. The World Health Organization estimates that the actual death toll could be more than double the official count in these regions. The lack of access to vaccines and effective treatments has further exacerbated the situation. Moving on to medium revenue countries. These nations typically have more robust healthcare systems than lower revenue countries. However, they too have faced their share of challenges. While they have been more successful in controlling the spread of the virus and managing the mortality rate, they've still had to struggle with issues like vaccine accessibility and the strain on their health systems. Lastly, let's look at high revenue countries. Despite having the most advanced healthcare systems and the highest access to vaccines, these nations have not been immune to the devastating effects of the pandemic. However, their mortality rates have generally been lower. This is largely due to early and aggressive responses, widespread testing, and the ability to provide advanced medical care to those infected. However, it's important to note that these are general trends and individual country experiences may vary. Factors such as government response, public compliance with safety measures, and the prevalence of comorbidities in the population can significantly influence the impact of the pandemic. The stark contrast in these numbers is a sobering reminder of the inequality that pervades even in times of global crisis. But the death toll is only a part of the story. The impact of the pandemic goes beyond mortality rates. The effects of COVID-19 have permeated every aspect of society, casting a shadow far wider than the grim statistics of death tolls. Our healthcare systems have been strained to their limits, with hospitals and health workers worldwide operating under tremendous pressure. The economic impact has been equally profound. Businesses have shuttered, jobs have been lost, and economies have been pushed to the brink of recession. The pandemic has exposed and exacerbated socio-economic divides, with the most vulnerable bearing the brunt of its effects. And then there's the issue of long-term health effects on survivors. Long COVID, as it's known, continues to affect millions, with symptoms persisting months after the initial infection. This includes fatigue, brain fog, and a host of other symptoms that can drastically alter a person's quality of life. While we grapple with the immediate devastation, the long-lasting effects of this pandemic are yet to be fully understood. As we continue to navigate this new normal, it's clear that the true cost of COVID-19 is far greater than the number of lives lost. The global impact of the coronavirus is a complex and ongoing narrative. What are the key points we should remember? Firstly, the sheer scale of the pandemic is staggering, with estimates placing the death toll at nearly 15 million, more than double the official count. The virus has left no corner of the globe untouched. However, it's crucial to remember that these impacts have not been evenly distributed. Countries with different revenue levels have experienced the pandemic in starkly contrasting ways. Wealthier nations have had more resources to combat the virus, while lower-income countries have been hit hardest, struggling with overwhelmed health systems and a lack of necessary resources. Beyond the immediate mortality, the pandemic has also had far-reaching effects. From straining global health systems to the long-term cost of long COVID, the ripple effects of this crisis will be felt for years to come. As we continue to navigate this global crisis, understanding these disparities and impacts is crucial in our collective fight against the coronavirus.